Mr. Chairman. And Dr. Elmendorf, and we'll continue this conversation right now. First on healthcare before I get to broader issues. You just mentioned that you believe, or that in your estimates, that the healthcare law would reduce the labor used in the economy by about 0.5%. Given that I believe you say there's 160 million full-time people working in 2021, that means that in your estimation, the healthcare law would reduce employment by 800,000 in 2021. Is that correct?
Yeah. So the way I would put it is that we do estimate, as you said, that the household employment will be about 160 million by the end of the decade. 0.5% of that is 800,000. That means that if the reduction in the labor used was workers working the average number of hours in the economy and earning the average wage, that it would be a reduction of 800,000 workers. In fact, as we mentioned in our analysis last summer, the legislation also creates some incentives that might affect the number of hours people worked. It might affect the propensity to work of lower and higher income people. We haven't tried to quantify those things, but the impact is that the 800,000 might not be exactly the number.
Oh, sure.
But it's the equivalent of withdrawing 800,000.
Sure, but that's your best estimate.